hello. Crack this one real quick. Okay. Turn the music just a tiny bit, please. Welcome in. It's our first ever workshop and appreciation event, so thank you for being a part of it. It's a small crew of us, but I'm happy to see you guys here. Thanks for coming. So, just a kind of overview of what's to come. I'm gonna keep this kind of brief, but we can kind of chit chat as we go. And afterwards, if you have any questions about any of the things I'm talking about, please, by all means, let me know. But again, thank you guys so much for coming here. We appreciate you taking the time. I know some of us might be a little sleepy, a little late in the day, but that's all right. So, wanted to kind of give you an overview. So, introduce my team here, our physical family. Talk to you a little bit about what PT is, why is it useful. Obviously, a lot of us in this room have had PT or are currently having PT. Also want to talk to you about direct access, and then we're going to talk about PT for the knees in specific. And we're going to be continuing having events like this where we're talking about specific body parts or specific maladies. Next month, for example, we're doing Fight the Fall. It's actually a national campaign with all of our national physical partners, and so we're talking about fall risk and how to prevent that and balance, and really trying to work to gain some strength and find some ways to get around that. And then lastly, we have a little sign-up sheet for that next event. If you wanted to sign up ahead of time to come up for that, that would be wonderful. So, oh, cute little picture. So I think we all kind of formally and informally met each other, but this is us. So Beth, our owner in the back here, a wonderful leader. Christy, the DPT, partner in crime. Of course, Gracie, couldn't do anything without Gracie. She kind of does it all, Jill of all trades. And then of course myself, I'm a physical therapist assistant. My name is Daniel. So, what brings you in today? So, I currently have knee pain. Your doctor suggested it. Someone you know has knee pain. You came for the snacks, Leo.
We got extra, Leo. So we're good.
You know, whatever. Figured good way to get people in the door. And you may have heard that knee pain is a problem and you want to avoid having it in the future. So whatever brings you in, I'm glad you're here. We're going to talk a little bit about that today. So first and foremost, what is PT and why is it useful? A lot of people have misnomers about physical therapy and what exactly it is. Pretty simple. Physical therapy, or known around the world as physiotherapy, common treatment that can help you recover after an injury or surgery. Pretty simple. We manage symptoms of your pain or your injury or your recovery or rehab after the fact. So you hurt yourself or you have a surgery, we treat you. Now, PT is not just for post-care. It's also known as prehab. So a lot of people will come here, they're trying to fight things like Fight the Fall, our event next month, trying to find ways to prevent future breakdowns. So muscle breakdown, osteoporosis, muscle weakness, muscle dystrophy, some stuff like, or atrophy rather, a little bit of both. And so you don't have to be currently hurt to come have PT. We want to see beforehand, and it's kind of our overall view on this clinic is we want to be kind of a lifelong partner with everybody. Whole wellness all the time. So whatever you're thinking you might need some assistance with, whether you are injured or not, come see us. That's what we're out here for. Direct access. So I want to bring this up because it's important. A lot of people think, because it was the case before 2015, that you need to get a script or you need to get a referral from a doctor, physician, to come to physical therapy. That is not the case, and I want to make sure that all of us in this room spread that information as much as we can. You do not. We are a direct access state. In fact, all 50 states are direct access states right now, and so that means if you want to come to physical therapy, all you have to do is call or come in. We'll get you on the books. Please let your friends and family know about this so they're not worried. Sometimes it's like, man, I really don't want to have to go to the doctor, get a referral, go through all that rigmarole, and then I finally get to go see a PT. No, come on in.
And so insurance will pay?
Yes.
Without having the doctor's report?
100%.
Any
Excellent question.
insurance that you have?
Well, there are some, so that's something that we can have friends or family call us. We can check what your benefits are. We'll see what your options are, and we'll let you know. Some people, they might not have insurance, or their insurance might not be something that they have a big deductible, or they don't have any deductible left. We'll put them with Gracie here and have her do her job, which is to make sure that they get on the books with us. So.
And the main insurance we need anything for would be Medicare,
along with the collaborative care approach that we have here. And so we're not just seeing you, you're just doing PT with us. We want to communicate with all of your caregivers. Whatever you got going on, whether you have a specialist, your primary care, an ortho, post, or pre-op, we want to talk to them. We want to make sure we know what do your blood labs look like, so we know, okay, why are you getting dizzy? Well, maybe you have something going on with your blood. We need to get your nutrition right or your medication right. All that is something we want to advocate for you guys, because it's hard to navigate the medical world, even harder to navigate the insurance game. That's what we're here for. We want to be advocates. So, knee pain, kind of what we're focusing on today. Kind of want to talk about who it affects, how it affects you, what to expect, how we treat it, how long does it take? That's oftentimes the question people have. How long is this going to take? When do I get to feel better? Let's talk about it. So first and foremost, you're not alone with knee pain. Like, so many people have it. In fact, studies show that osteoarthritis in particular is very, very common. A couple tidbits, more common in women than men. Prevalence does increase with age. Obviously, our bodies start to wear just a bit, and that starts to pop up. And of course, not just osteoarthritis in the knees, but other places in your body. But for now, speaking about the knees, 45% of women over the age of 65 have symptoms, but imaging testing shows that up to 70% of people over 65, regardless of gender, at least show some signs of osteoarthritis. So that's part of what we're looking to spread information about. Okay, am I at risk? Is it something that I need to be concerned about or start thinking about doing prehab for, so we can fight some of those osteoarthritis symptoms in the knee? So to that, who's at risk? Well, a lot of people. Some factors that increase that risk: age. Obviously, we talked about that. Once you're over 50, it starts to kind of increase. Of course, your gender, females get it more than men. Obviously, weight, obesity, injury, repetitive use of joints. So we have a lot of people that are athletes or were athletes. We work with athletes in here, and we're an active community. A lot of people are getting out, walking, hiking, biking, whatever it may be. If you're using your body, you're using your knees a lot, you're going to get some hammering. And so kind of got to be mindful of how those joints are going to continue to take care of themselves, or you're taking care of them in the future. But then, of course, muscle weakness and joint laxity. So especially as we age, or even after moments of being sedentary. So if we have an injury, we're in the hospital, we get sick, we're down, bedridden for a long time, pretty quickly, our muscles are gonna start to lose their strength. So that's part of it as well. Also lack of activity, and so that muscle weakness does become a big part of that. Part of why we're talking about this is, and the whole goal of why people want to come to physical therapy for prehab or rehab, is they want to keep doing the things that they love doing, plain and simple. Or they want to be able to do things that they haven't been able to do for some time because their body has started to break down on them. So whatever it is, I think a lot of people, hey buddy, welcome in. Come on in, grab a snack. So, all these different activities that we see here, even if it's just your activities of daily life, being able to go to the grocery store and go out and hang out with friends, doing that comfortably and safely is a big piece. And if our knees are giving out on us, that makes it problematic. That's kind of why I wanted to talk about this here today, because that's what we're here to help with. So, first things first, imaging. So this is a great way to tell us a tale of what's going on with our bodies. Most of us, probably all of us, have had x-rays or MRIs in the past. Here's the thing, it doesn't always tell the whole story. So for example, as we see here on the left, that's a healthy knee. So we have pretty good space in between. So that meniscus, that cartilage in our knee, that helps cushion the blow. Every time we take a step, every time we jump, we're putting impact on that joint. You can't see it in here because it's an x-ray. On an MRI you could, but there's a lot of nice space in here. These edges are really smooth. Now a knee with osteoarthritis, and with the osteoarthritis comes desiccation of that meniscus. So the meniscus gets really dried out and it loses its cushion. Right? You see how close that is? You see these little jagged edges in here. That's that stuff when you start moving your knee. Anybody's knee like kind of creak and make noises, crackles, pops? That's that stuff. These little bumps in here cracking around. So that gives us an idea of what's going on with the knee itself. but it doesn't necessarily tell the whole tale. So part of that is our musculature. And so that's a big piece of what we do here in PT. We are gonna work on your joints. So there are things that I'll talk about, different remedies if you have a lack of meniscus or you have osteoarthritis in your knees. There are other things we can do, but first and foremost, we want to look at how the knee is actually functioning. So how are your muscles going to play a role? So muscles and tendons, muscles connect to tendons, right? So if we have that tendonitis, that's going to cause a lot of pain. That's something that we treat, trying to strengthen the tensile strength of your tendons and muscles so they can support that joint. Strength, I mean, by and large, pretty simple. The stronger you are, the healthier joints are going to be because they have more support. Now, that said, a lot of people, they start having knee pain or any kind of joint pain, but specifically knee pain, and they stop doing things. Like, that's going to hurt, so maybe I'll skip out on doing this event. Maybe I won't go do X, Y, or Z. That's kind of the backwards thinking that it just frustrates because you can go do these things. I want you to be able to move around. In fact, that movement, you might have heard this stupid phrase, motion is lotion. It is. The more you move, the better your body will feel. We have synovial joint fluid so in our joints, right along the kneecap here, and in all of our joints, it's kind of like grease, kind of like WD-40. And so the more we can move, the more that grease sort of turns around in the joint, makes it a little bit more fluid and easier to move around. That's why you might wake up in the morning and you have a little bit of joint pain, a little stiffness. But as you start to get moving a little bit, it feels a little bit better. That's kind of what I want to take away from this. The more we can move, the better we'll feel, within reason. And so that's why we exist, so we can kind of tell you how to treat it, how much movement is too much, and kind of give you a prescription, give you a home exercise plan, things that you can take away and do on your own without overdoing it. Because that's the fear. And people stop moving because they're like, well, I don't want to hurt it any worse, and then I'm not able to even get up out of bed. Well, cool, we'll help you out. That's the benefit of having a PT. So as far as treatment, there's a lot of ways to do this. So in PT, stretching, obviously, I know my wife here, we talk about stretching quite a bit, and it's important. It's hard to make time for. Even myself, Christy, you can probably bear witness, we probably don't stretch enough either. And so if I tell you to stretch, it's only because I know I need to be doing it too. And so trying to get a little bit more elasticity, a little bit more movement in our joints and our muscles, super helpful. We can give you specific stretches to help strengthen your knees. So your quadriceps, your hamstrings, your calves, all those things, they play a big role, but all the way up the chain as well. And so a lot of times we have knee pain, we don't know that that is actually related to what's going on in our hips. It might be related to what's going on in our backs. So you come in for knee pain, or a friend of yours comes in for knee pain, we're probably gonna talk to them about their whole body as well. Other things, manual therapy. So massage, trying to do joint mobilization, strengthening, isometric, isotonic, and dynamic. So there's a lot of different ways to strengthen your body. We're gonna do a little bit of everything so we can get you really moving so you're kind of prepared for anything and everything that you need to go out and do. The other cool thing, we do electrical stimulation as well as ultrasound, and I'll talk to you a little bit more about that. This little guy here, really cool device. And so that's a big piece of what we do to add into the physical movement, adding some kind of stimulation to those muscles. Sometimes we just need to get that muscle firing. Maybe you have knee pain and you just can't move that much. Well, cool, we can put some E-stim pads on you, like these little guys. And that will send kind of a little electric signal into your muscles, making them contract. That helps that movement. And so that's gonna increase your strength over time. Cool new fun toys. So we are working on getting a class 4 laser in here, and that will be another event that I wanna hold here. So talk to you guys about that. Really cool piece of technology that really helps as far as vasodilation, getting your blood pumping, kind of regenerating your muscular growth and your recovery on the cellular level. Really cool piece that I'll chat more about in the coming moments. But we've heard a lot about the traditional medical approaches. So a lot of times you go to the doctor and they'll prescribe you, and it's been the case for the last 20 years, OxyContin, oxycodone, Vicodin, pain meds. That's what we're trying to get away from. Like there's an opioid epidemic, and that's something that we're trying to avoid. We don't need to pump people full of pain medication unless it's necessary. It's a means to an end. But if we can use some of our therapeutic, more conservative approaches to keep people from having to put toxins into your body, that's what we want to do. It's really important. Nobody wants to be walking around like a zombie for the rest of their life because they can't get away from their pain, and all their doctor is doing is prescribing them pain medication. That's why we're seeing a lot more referrals from doctors to physical therapy, because it's more and more controlled. The narcotics are more and more controlled, and so that's a good thing. But there are great medications, things like ibuprofen, Tylenol, topical agents. There's a lot of stuff that we can talk about using without necessarily putting too many harmful toxins into our bodies. There's also shots, so injections. That's the thing that we can speak to you about. Sometimes we just have inflammation in our knees. You might have had a corticosteroid shot already, or you've heard about them. And so giving a corticosteroid shot into your knee, that's gonna alleviate a lot of that inflammation so that you're out of pain. The inflammation in our knees is what causes a lot of that pain. It's just kind of full and doesn't have a good range of motion. Every time we move, it just crunches because it's so inflamed. Those steroid injections, it's pretty quick, takes them about a minute or two to do, and for the most part, pretty efficacious. I think it works for a lot of people, not everybody, but it gives you a couple, 3, 4 months of pain relief so that you can come to PT and be able to function and work on your strength. That's kind of that order of operations. I'm a huge proponent of injections. I just think that it's super useful, but you don't have to do it forever. The idea is get you out of pain with the injections and then get you the strength that you need while you're out of pain here in physical therapy. And lastly, the old school rest, ice, compression, heat is also on this list. That is stuff that we're gonna give you guys as well. And so just knowing how to and when to, a lot of times people are like, I heard I'm gonna put ice on it. I should put ice on it. Maybe ice isn't the right thing. Ice helps with pain, but it doesn't really help with movement, right? Ice kind of makes our movement a little bit less, makes things a little tighter. So maybe heat is the right thing to do. We want to educate our patients and let them know, okay, what is actually going to be beneficial if I start to get pain or if I start to lose range of motion. It's hard to tell sometimes. There's a lot of old wives' tales. People don't necessarily know which way to go. That's why we want to be advocates for you. Make sure that you know what you should be doing and when. So, show and tell time. So I just wanted to kind of end with a little bit of exercise. And so showing some fun things that we can do, and there's so many, and everybody presents differently. Everybody has different levels of pain, different levels of need, but as it comes, or as it pertains to knees, there's some pretty good stuff that we can do, and I wanted to show you here. And so, real basic, in fact, I'm gonna steal this chair right here. So sitting to standing. Would you like to come sit to stand with me?
Oh, sure.
Oh,
I
good.
was not going to take cards, but.
No, that's okay. All right. So, pretty simple. So, pretty basic stuff. Like we all sit down, stand up, part of our normal life. But if our knees start to hurt, it gets a lot harder. So some real specific and simple cues that we can use are, so when you sit down, ideally, well, this doesn't have a hand rest, but that's quite all right. So ideally, we want to get as close as we can to the chair so we are not at risk of falling. So bring back up our legs to the chair. And as you're sitting, I want you to kind of put your weight into your heels and then lower yourself down. Good. Same thing. So another thing, getting a little bit wider base of support. I know I've talked to a couple people in this room about wide base of support and its necessity. Sorry, I know maybe I should steal him. Yeah, come here, buddy. Sorry,
I do have
Gracie.
shorts on.
Okay, cool. So, good. Wide base of support. The wider our legs are when we're sitting to standing or standing to sitting, the less likelihood we have of losing our balance. I often use the analogy, it's like a redwood tree. A redwood tree is nice and big and thick, and it grows really tall. Why does it grow so tall? Because it can. It's got a huge base of support, so it's not going to get kind of torn to and fro with the wind. Same thing, when you see a little sapling, it's teensy weensy and it blows in the wind, no problem. It's gonna lose its balance. Same thing with you. So keeping that nice wide base of support on your knees, between your knees. Now, as you stand up, I want you to put your nose over your toes just a little bit. As we're standing, we want to drive through our heels. A lot of times we put all of our weight onto our toes. Two things, that's going to hurt our knees. That drives pain right under that patella, that kneecap. But we have big muscles, our hamstrings and our quadricep muscles. This whole section here, you can really activate by driving your heels through the ground. So as you stand up, bring your torso forward just a little bit. I want you to drive through your heels and stand. There you go. Good. Same thing as you're sitting down. Pretty straightforward. It's just sitting and standing, but if you've had knee pain, that's not always so easy. I'm sure you can bear witness. So, thank you. Can I use you for some more?
Yeah, of course.
Cool. I know I didn't. I'm not paying her anything. So that's super cool. Okay, let's talk about this guy. So, total gym. I'm gonna have you pop on this platform here. So, when we're trying to build muscle and trying to build some endurance, this is a wonderful tool that we use. So we can set this at varying levels. This right now is set at the highest level because he's a super strong guy and he's gonna be just fine. If it wasn't, I can set this even lower so it's really easy to use. You're not having to put a lot of force. So if you are post ACL surgery, if you are having really acute chronic knee pain, you can attest to the ACL surgery. She's torn her ACL and meniscus. So we're gonna put it down really low so it's not so difficult to use. But same concept with this, we're gonna start. So you're starting just about 90 degrees at the knees here. Same thing, I'm gonna have him start driving through the heels. So drive up through your heels and push up. Good. I want you to come down a little bit slowly. 2, 1, good. And drive up through the heels. Pretty simple, nothing to it. Now, we can make this even more challenging. So, go ahead and drive up. A little harder. So, you are strong. Okay, you must work out. So, we can kind of fiddle with how we use this, but it's really great because it's safe. You're lying down. You can't get hurt. All we want to do is work on these muscles. Really try to engage those muscles and build a little bit of strength. Another fun way, so when I was telling you when we stand up from seated position, if we're going on our toes, kind of hurts the front of our knees. This is a great way to strengthen those muscles without losing our balance or being at risk of falling or hurting ourselves. So what I want you to do is bring your knees down, your feet down on the platform just a little bit. I want you to put the weight through your toes. So bring your heels up off the platform a little bit, and I want you to push with your toes all the way up. Obviously, he does work out. He does probably a lot of squat and leg press, I assume. So he's naturally keeping a nice space between his knees. That's oftentimes a big issue for a lot of folks, especially when we lack that knee strength and hip strength. So our knees kind of bow in like that. We really want to try to drive those legs out. That's something we help people reinforce, these good habits in the clinic, so that when they go out into their regular life, when you go to sit down for dinner in a nice restaurant with your friends, trying to have a good life, it's not so dang hard, pretty simple. Another one we can do as we progress, and that's the whole point of this. I want to progress so that you get stronger and stronger and stronger. Let's see if you got it in you. So, I'm gonna have you come down. I'm gonna have you drive through your heel, but I'm gonna have you bring this leg up for me. I want you to do a single leg. Good. Same thing, drive through your heel. Good. What's cool about this exercise with this is that not only is he working this single leg, making it really a challenge, that helps with single leg balance, right? So when we're walking, as we walk, we're spending a good bit of time on one foot. This helps with that. So if you're having trouble with walking, if your balance is off, super helpful. Thank you, I appreciate that.
Yes, sir.
Good man. So, you guys. Thank you, buddy. Let's see. Another volunteer. How about you, miss?
You knew it was gonna happen.
Okay, so the unsung hero of knee pain rehab is our tibialis anterior. So on the front of our shins, everybody feel your shins. You got this muscle right there. We never work it. We always worry about these big calf muscles on here, which are great. But this tibialis, so when we walk, we're putting our foot forward like that. That tibialis is what makes your foot go up, like that. So if you're walking and you're having trouble catching your toe, you might have foot drop. That's something that's really, really important. Now, when you start to have knee pain, sometimes your walking gets a little bit challenging. And so to help with that, we can do tib raises. However you're comfortable. So I'm gonna have you pull your pant legs up just so people can see your feet. I'm gonna have you put your back against this wall. Good. Now, I want you to bring your feet out just a couple inches. Okay. So I want you to just rock back and put your feet up in the air. There you go. So back down nice and slow. Come up and down. Up again and down. So she's a ringer. She's got really good tibialis anterior muscles. Better than mine, I know. So this right here, it gives you so much stability. And this is the easy thing to do at home. Pretty simple. You're lying on the wall, fairly safe. So if you can just spend some time doing some tibialis raises, it makes your gait stronger. It makes that pain that you have right underneath your kneecap start to dissipate because you're strengthening that tendon and doing that, strengthening that muscle. Thank you. Great job. Pretty simple stuff, and that's a lot of these things you can do at home. This, you want to come see us. But that said, there are versions of these same exercises, this included, that we can give you at home to do that are a little bit easier, and you don't need a bunch of machines. So, last thing we want to talk about, well, I guess we'll talk about a little bit of E-stem. Shoe and insole consults. So, a lot of times we'll send folks over to Gardanos. You may be familiar. If you're not, they're great. They've been in business for like 45 years down in Denver, and they have a brick and mortar over across from the Flatirons Mall. They're awesome. And so they sell all kinds of different footwear, from sneakers to sandals to boots. The benefit is that it's not just like you're going to a random shoe store. They actually know what they're talking about. They'll put you on a little machine so they'll see kind of where your feet are putting pressure on the ground. And so a lot of times our knee pain is derived from lack of support on our shoes. For example, I have pronation. So when I step, my foot goes in like that. That has given me massive knee pain and hip pain and back pain for a lot of years until I started adding insoles into my shoes. Tremendously helpful. So if you're having knee pain, you're having back pain, but specifically that knee, that's something we're going to give you. We're going to get you set up with Gardanos and get you the right shoes or insoles, so you know you're getting something that's actually worth the money. And they're pretty cheap. It's like $50, $60 as opposed to $300, $400 if you're getting orthotics from like a podiatrist. So these little elements, all these little exercises and elements, are pieces of what we want to do to help you out. Yes, sir.
Would orthotics work on that? Keep you from doing this?
Yeah, I think they certainly could help. Now, here's the thing with your gait. Let me seal you. Come here. Come here. So, as you're walking, and I haven't noticed that you have much supination or pronation. So I'm not overly fussed about your ankles and your foot support. The support of your shoes, those aren't bad, but it is something that we can certainly add to the mix. If you had a little bit more support in the shoe around the ankle, that could help. So like, for example, these are easy to get off and on, but you're lacking a little bit of support around here. So that's something to consider, absolutely. But that goes along with the rest of the work. So doing more strength training to your legs, upper and lower, which obviously you've done. So, but it's never a bad idea. Here's the thing, if you have questions, if you're curious at all, go to Gardanos, chat them up. We do sell insoles here as well. We just have a little bit more limited selection. They have literally everything, right? And so it's a great way. We can give you a little prescription here. These things are awesome. This way, that way, people know exactly, okay, you've talked to your PT about this. They know what's going on with your feet and your ankles. Here's what we're gonna start looking for. So that way we're in communication, like I talked about earlier, about collaborative care, working with your providers, the people that are trying to help you. Giordano's is a shoe store, it's still a provider, it's medical equipment. We want to be communicating with them to make sure you're not just wasting your money and time, right? Okay. So, last thing, this little guy. So some of you guys have had this audio. So ultrasound and e-stim. So ultrasound, wonderful technology. We've all heard of ultrasound for obviously pregnant women, lets you see how the baby is doing, in utero. But this is also great. It sends sound waves into your body and kind of warms up and excites the cells in there. That can generate blood flow. It can also help relax the muscles. You have a lot of muscle spasms, triggers, things that are causing you pain and discomfort. This really helps. And so it's something that we do alongside that physical therapy and exercise portion that's super beneficial. And oftentimes we'll pair that with the e-stim that I was talking about earlier. These little sticky pads, you hook them to these wires here, and we zot you. Pretty simple. So it's a careful zot. I'll mind my P's and Q's. But for example, if I was trying to strengthen your knees, I want to strengthen your quadriceps. So I'm going to put these electrodes on your quadriceps, and about every 10 seconds, you'll feel those quadriceps contract. Now, you can either just kind of hang out there and let them contract, or oftentimes what I'll do is, while it's contracting, because you're being hit by that electrical current, I'll have you doing an exercise at the same time. So you're learning how to, it's kind of retraining your nervous system. So that way, you're getting just a little bit of assistance. Pretty beneficial. Research shows that this is such a wonderful, useful, in fact, I did a whole project on this in PTA school, the benefit of this as well as ultrasound. And so that's a piece of what we do as well. So just kind of some tidbits. I know a lot of you guys kind of know a lot of these pieces that I've told you, but friends and family don't. And this is why I want people to be able to share with their friends and family. What do we do? What is physical therapy? What kind of stuff should I be expecting? And certainly what they should be expecting is quality of care. That's a big thing, and I'll end with that, is that what we've set out to do here is create a physical family, right? So you're not just clients, not just patients, you are part of our physical family. We want to be a part of the rest of your life, the rest of your wellness, and make sure you know you have a good advocate. So many times people have told me horror stories about going to the doctor and having a poor time, doctors with bad bedside manner, PTs who don't really care, they seem like they're checked out or burnt out. We don't do that. We want to make sure that you know that we actually care. So if you ever have any questions, obviously we're right here. If you know anybody who has knee pain or any kind of pain, please send them our way. We just want to make sure that we are doing everything we can to be a benefit to our community. And so with that, unless anybody has any questions, I think that's